Hi friends, let's continue our education on the topic of digestive tract. And today, lecture 15F on the topic of liver, and we will cover liver detox. It will be introduction lecture, and we will cover several topics such as what is detox, where toxins are coming from into our body, and who may benefit from the detox. And also I will say a few words about phase 1 and phase 2 of the detox. This is continuation of this lecture on the liver, functions of the liver, and the detox is function number 8. Before we go to the blackboard, you need to know the blood flows through the liver. So this is the liver. The yellow is the digestive tract. All the blood from the digestive tract will come through the portal vein into the liver, get clean from the chemicals from the digestive tract, and get released into the hepatic vein. From there, it will go into the lungs, into the heart. There is also lung supposed to be here. It will pick up oxygen and will give up carbon dioxide from the lungs. It will go through hepatic artery back into the liver. Before we go to the blackboard, I want you to do the following thing for me. Take a piece of paper, and as I will be talking about possible chemicals that come into your body from different sources, write down write, like, if you do, like, for example, chemicals can come from this source, and you will write yes, yes, or no, no. Why? Because it will make you decision of doing or not doing detox for you much easier. When I was in the practice, I help patients make a decision. What kind of detox you are going to do? Is it going to be easy peasy, or is it going to be heavy duty with herbs and supplements? Is it going to be detox only for 1 week, or maybe it's going to be for 4 weeks? So let's go to the blackboard. As always, I already pre-drew for us a picture of the digestive tract. Black is digestive tract. Here is your mouth with the teeth, and the food will come in here. What kind of chemicals can come from the food through the digestive tract in our bloodstream? Number 1, herbicides and pesticides, preservatives, also drugs, antibiotic, non-steroid anti-inflammatory drugs. So they will all go here. They'll drop into the stomach. They'll broken down here through the digestive tract in the smallest particles. And those green lines is the blood that get absorbed, that will carry those nutrients. Those nutrients will get absorbed into the bloodstream. This green bloodstream will go from almost all the digestive tract and will arrive with this green line into the liver. This black is liver, and the liver will do detox. So the drugs, herbicides, pesticides, all kinds of chemicals will get broken down here, and the clean blood will go out of the liver into the central blood circulation. So this will be the clean blood. Eventually, this blood will go into the heart. Also here we have a skin, and this is the fat. Chemicals can come from the skin. For example, women will love to apply all kinds of creams on the skin. Chemicals from those creams will get absorbed into the bloodstream right here and will be circulating. Sunscreen. I have here on YouTube a video floating that I made probably 8 or even 9 years ago. I absolutely do not like sunscreens because they are so full of chemicals, and I backed up the information with scientific articles that say that when you put sunscreen on your skin, all those chemicals from sunscreen end up in your blood circulation. Person who has decided to lose weight, in many cases, fat-soluble substances, chemicals get stored here in the fat. When you're losing fat, the fat cells get destroyed, chemicals get released, and they go here into the bloodstream in the general circulation, and eventually will end up in the liver. People who do intravenous drugs, I write here IV. So drugs, for example, if you had a surgery 6 months ago, you get intravenously anesthesia. The anesthesia is a drug that will circulate in the blood and eventually through the bloodstream will end up in the liver for the detox. So the blood goes into the heart. This is our heart, and it will go into the lungs. This blood is full of carbon dioxide. In the lungs, carbon dioxide get exchanged for oxygen, carbon dioxide get exhaled, oxygen comes in. We can pick up chemicals from the air that we breathe. Who are the people who may pick up chemicals? Number one, drivers. Okay, or people who work along highways and often breathe the chemicals from the cars. Painters, house painters, they work whole day with the chemicals, they paint your house and they breathe it in. Also, in the past, I had several patients in my practice who were artists. They worked with Sharpies and worked with other paints, and they also breathe it in. So the chemicals we get breathed in and will get into general blood circulation, and eventually with the circulation, it will go into the liver, and liver will do detox. Within the liver, we have cells that full of enzymes, and those enzymes, they will do the job. So when the toxins are coming from different sources into the liver, they get broken down through the different phases, and there are two of them actually. Phase one done through cytochrome P450, and then it will go to the phase two. From the phase two, it's get excreted either through the bowel into the digestive tract, or will go into the serum, will go into the kidney, and you will pee it out. And that's basically it, guys, for today. If you have any questions, please like, subscribe, ask me questions. And if you need a health coach, just let me know through my website. Bye-bye for now.